Na tukirudi hapa jijini ni kwamba naibu rais ameongoza mkutano na mabalozi pamoja na magavana katika juhudi za kutafuta ufadhili wa miradi iliyoko chini ya ajenda 4 kuu za serikali. Katika mkutano huo mabalozi waliibua masuala ya ufisadi ambayo yanatatiza sekta nyingi nchini, wakiitaka serikali kukabiliana na jinamizi hilo. Ruto ambaye amepigia upatu kuzinduliwa kwa mpango wa matibabu bila malipo, amewahakikishia wafadhili kwamba pesa watakazotoa hazitafujwa.
So the success of this pilot program under the 4 counties would be very important for us. However, it is also important.
One of the other shortcomings we have found of the current scenario is that unless we are able to access resources direct to the facilities, the lead time when the money flows through the county has its own challenges. We'll also be looking at operationalization of the performance-based management at the facility level, as well as strengthening of quality and standards in service delivery. The key priority investment areas for us to achieve our target, 4-fold. One is community services, where we are investing at least 2% of the new resources. We have the bulk of the resources going to basic and specialized services across the various levels up to level 5. We'll be looking at another 17% of the new investment going to health system strengthening, and a residual 0.8% will go to public health services.
You have 2 minutes, Minister.
I will skip a bit of what I have here and I will go to where I see the opportunities, or where we have seen the opportunities with this new model, leveraging on the political commitment which Your Excellency is cutting across the national government but also the counties as we continued consulting, with the assurance of increased funding due to the high political commitment. Therefore, we'll be reinforcing to the citizens the right to health as provided in the Constitution.
NHIF. So there is a record now of what NHIF can do if we can resource it better, we can reform it, we can get it to do what we want done. We subsequently mainstreamed also private people who are not necessarily on formal employment by having a fee of 500 shillings, which again was controversial a bit because many people thought it was high. What I'm trying to drive at is that we have seen over the last 6 years that there is room for us to move in the direction of health insurance. And that's why we want to stretch it. The farthest it can go, of course, is universal health coverage. But I'm sure that with the pilots we are doing, we will be able to know how far can we go. I was just giving you that background so that you know that we have an experience, because I'm hearing that we need to be careful about governance issues, which is a major issue. And that has been a major issue, and we have to progressively underscore that fact of accountability and matters governance, because the resources available require that for us to get benefit out of it, it must be used in an accountable manner. So, and lastly, NHIF used to ask private sector hospitals to pay to provide service. So when we engaged NHIF and we told them, you have no hospital. If somebody has built a hospital, why are you charging them to provide service to your clients? So finally, we managed to get NHIF to register, to have a criteria that registers hospitals, credible hospitals, without charging them any levies, so that we can have more players providing healthcare and more facilities being brought into the net. So I think that is the extent to which where we are. There is some good progress, but we can definitely do more with this push now for universal health coverage.
Questions of accountability and transparency.